Look at yourself in the mirror right now. Not at your hair, not at your overall complexion. Look specifically at the space directly beneath your eyes, that soft, puffy shelf of tissue that sits there like a shadow that never fully lifts. Maybe it arrived gradually, barely noticeable the first year. Then you saw it every single morning. Then it stopped going away entirely. And now it's just part of the face that looks back at you. You have probably tried everything the internet recommends: cold metal spoons from the freezer, cucumber slices held in place for 10 minutes, eye creams with ingredients you cannot pronounce, selling for prices that still sting when you remember them. You reduced salt, you slept on an extra pillow, you drank more water, then less water. You got more sleep. Still there, still puffy, still making you look 10 years older than you feel. Here is what nobody in any of those product advertisements and almost nobody in any clinic waiting room has ever told you. Those bags are not a cosmetic problem. They are not a sleep problem. They are not, in the overwhelming majority of people over 60, a genetics problem. They are a signal, a specific, readable, physiological signal coming from an organ the size of your fist, tucked into the middle of your back, quietly doing a job so critical that when it begins to slip, the first place in the entire body it announces itself is right there under your eyes. Every single morning, your kidneys are speaking, and by the end of this video, you will understand exactly what they are saying and what to do about it tonight with nothing more than your own hands. Stay with me through this entire video. The self-test and the 60-second technique I am going to show you are things most people have never been offered. Not because they are complicated, because there is no financial incentive for anyone to explain them. Subscribe right now and hit the like button. Every person who finds this channel finds it because someone who watched chose to share it. What you are about to learn is worth sharing. Let me start by dismantling the explanation you hear most often. It's just water pooling while you sleep. Lie flat, fluid collects, stands up, it drains. That is partially true for someone who is 35. After 60, something fundamentally different is happening inside the tissue beneath your eyes, and the proof is already sitting on your face. If overnight gravity were the only mechanism, the puffiness would clear within 1 to 2 hours of standing up and moving around. But yours doesn't fully clear. Or it clears partway, lingers through the afternoon, and returns worse the next morning. That pattern has a name. And it points upstream past the eye, past the face, to the organs and systems, doing the filtering for your entire body. Let me explain the anatomy first, because it matters. The skin beneath your eyes is the thinnest skin on the entire surface of the human body. Everywhere else, your cheeks, your forehead, the back of your hands, the skin, rests over dense subcutaneous fat and tightly woven connective tissue. The tissue under your eyes is structurally different. It is extraordinarily loose, almost sponge-like, with minimal resistance to fluid accumulation. This is not a design flaw. It allowed the eye muscles to move your eyes in every direction for millions of years of evolution. But that looseness has a consequence. Think of your under-eye tissue as the floodplain of a river. When the river is running at normal volume and the drainage channels are clear, the floodplain stays dry. When something goes wrong upstream, when the river carries more water than it should, or the drainage channels are narrowed or blocked, the floodplain fills first, before the surrounding land, before anyone upstream has noticed there is a problem, every single time. The question is, what is happening upstream? Your kidneys filter approximately 180 liters of blood every single day. That is not an estimate. That is documented human physiology. They process your entire blood volume roughly 30 times in 24 hours, and they regulate with extraordinary precision exactly how much fluid stays in your bloodstream versus what gets sent to the bladder for excretion. Here is what changes after 60. Clinical research consistently documents that kidney filtration capacity, measured as GFR, glomerular filtration rate, which simply means how many milliliters of blood the kidneys clean per minute, declines at an average rate of approximately 1% per year after age 40. By 65, a person may be filtering at 70 to 75% of their original capacity. By 75, some individuals are at 55 to 60%. And this decline announces itself with no pain, no locatable symptom, no dramatic event that would send anyone to an emergency room. It works the way sediment slowly narrows a drain. You don't know what's happening until the sink starts backing up. When the kidneys operate at reduced capacity, their ability to precisely regulate fluid balance becomes less accurate. Specifically, they respond less efficiently to a hormone called aldosterone, which controls how much sodium and water the body retains versus excretes during the night. When that signaling becomes imprecise, the body holds on to a slightly larger volume of fluid than it should, not dramatically, not enough to cause visible leg edema in mild cases. Just enough to keep blood volume and tissue fluid marginally higher than optimal all night, every night. That marginal excess finds the periorbital floodplain, the loose tissue under your eyes, and settles there, year after year. A slow, quiet accumulation. But there is a second mechanism operating simultaneously, and this one receives almost no discussion. Your face has its own lymphatic drainage network. Lymph vessels originate near the forehead and inner corners of the eyes, run outward beneath the skin of the cheeks and temples, and drain into lymph node clusters located directly in front of your ears and tucked beneath your jawline. These nodes act as filtration gates. They collect the lymph fluid that has gathered cellular waste, excess proteins, and fluid from facial tissue, process it, and route it back into the bloodstream through the neck and collarbone area. After 60, this system faces the same age-related changes as lymphatic vessels throughout the body. The vessel walls stiffen slightly. The tiny valves that keep fluid moving in one direction become less crisp. And critically, if you are not moving your jaw, your face, your neck with the same frequency and force you did decades ago, the facial lymph conveyor belt slows further. Every chewing motion, every deliberate neck rotation, every wide expression, these are mechanical contractions that squeeze the facial lymph vessels and push fluid toward those drain nodes. Hours of stillness, a sedentary day, a night of fixed sleeping position, and the drainage falls behind accumulation. The result is a reservoir that builds across days, weeks, months, until the mirror shows you something that seems permanent. Before we go any further, I need to be direct about specific warning signs that mean this video is not what you need right now. A doctor's office is. If your under-eye puffiness appeared suddenly over the course of days rather than months and is accompanied by foamy urine, dark-colored urine, or urine that looks like strong tea, get a kidney function blood panel this week. That combination, sudden onset puffiness plus foamy or darkened urine, can indicate protein escaping into urine through damaged kidney filters. It needs clinical evaluation, not a home protocol. If the swelling is dramatically asymmetric, one side significantly worse, and you have a history of thyroid surgery, cancer treatment in the neck or face area, or radiation to the head and neck, request a lymph node evaluation. If the puffiness is accompanied by rapid unexplained weight gain, shortness of breath at rest or lying flat, or significant swelling in your lower legs, seek cardiac and renal evaluation. That constellation of symptoms points to a different level of dysfunction that is not addressed by lifestyle protocols. If none of those descriptions match you, if your puffiness is soft, symmetrical, worse in the morning, has developed gradually over months or years, and you have no accompanying respiratory or urinary symptoms, then everything I am about to walk you through is directly relevant to what is happening in your body. Consider someone I'll call Evelyn, 63 years old, retired librarian. Meticulous about her health, takes her medications, keeps her appointments, reads the ingredient labels on things she buys. For nearly 4 years, she had been spending real money on under-eye treatments, clinical-grade serums, silicone patches she wore overnight. A lymphatic massage device she saw advertised with before and after photographs that looked compelling. Her dermatologist told her it was genetic. Her mother had had the same thing, so the case was essentially closed. What nobody asked Evelyn, not the dermatologist, not her primary care physician, was how much sodium she was eating after 6 in the evening. Nobody asked whether she had a glass of wine most nights. Nobody asked how much she drank during the day or when she stopped drinking fluids. Nobody measured her kidney function beyond the standard annual panel that showed her in the broadly normal range. when in fact, her GFR had declined quietly from the 90s to the low 70s over the preceding decade. Evelyn had been treating a reflection, trying to address the floodplain while the upstream problem continued uninterrupted. The morning she understood what was actually happening, not cosmetically, but physiologically, was the morning she stopped shopping for serums and started thinking about her kidneys. Here's how to test yourself right now with nothing but your hands. Press 2 fingers firmly into the skin directly under your left eye, the way you'd press a soft peach to check its ripeness. Hold for 5 full seconds. Remove your fingers. Watch the skin for 10 seconds. If it springs back immediately, smooth and even, fluid movement in that tissue is relatively functional. If there is a faint indentation that takes 3 to 5 seconds to fully smooth out, you have meaningful fluid retention in that periorbital tissue. If the skin feels doughy and the indentation is visible and slow to recover more than 5 seconds, that tissue is saturated. Now find the point I want you to use in the protocol. Slide your finger along your jawbone from your earlobe forward. Move slowly with a little pressure. About halfway between your earlobe and the point of your chin, you will feel a spot that is slightly softer than the bone itself, and in many people, mildly tender to firm pressure. That is a primary lymph node cluster, one of the central drainage gates for the entire face. Press it now and hold for 10 seconds. Notice whether you feel a dull pressure or mild tenderness radiating slightly upward toward your cheekbone. That response tells you the node is active and reachable. Remember exactly where it is. 3 things you are almost certainly doing that are making the morning puffiness significantly worse. The first is eating hidden sodium after 6 in the evening. Not table salt, you probably barely touch the shaker. The sodium is inside processed food. A standard serving of cheddar cheese contains roughly the same sodium as a large bag of salted chips. The fat and flavor compounds mask the sharpness so completely that you don't register it as salty. But biochemically, the effect is identical. When sodium enters your bloodstream in the evening, your body activates osmotic retention. It holds on to every available molecule of water to dilute that sodium load. That water saturates your tissues overnight. Your kidneys, working at reduced nighttime efficiency, cannot fully reclaim it before morning arrives. It sits exactly where tissue resistance is lowest. The second is alcohol in the evening. Even a single glass. Alcohol is one of the most potent suppressors of antidiuretic hormone, the signal the brain sends to the kidneys each night, telling them to slow down, concentrate urine, and reduce fluid output during sleep. When that signal is chemically blocked, the kidneys run at full filtration speed throughout the night. They process more fluid volume than they should. The overflow accumulates in the periorbital floodplain. This is not a theory. It is the direct, documented mechanism by which alcohol worsens morning facial puffiness, and it operates even with moderate, socially acceptable intake. The third is restricting fluids during the day because you believe it will reduce the puffiness. This strategy makes the situation measurably worse. When the body is mildly dehydrated, the fluid flowing through your facial lymph vessels thickens and becomes viscous. The difference between well-hydrated lymph and mildly dehydrated lymph is the difference between water and thin syrup moving through a narrow tube. Thin lymph drains your periorbital tissue efficiently. Thickened lymph sits. The protocol is not less water overall, it is better timed water, concentrated before early afternoon and tapered significantly after 4. 3 foods that actively support the 2 systems driving this problem. First, parsley. Not as a garnish you push to the side of the plate, as a therapeutic food consumed daily. Fresh parsley contains compounds apiol and myristicin that have documented mild diuretic properties operating through a mechanism distinct from pharmaceutical water pills. They support kidney filtration without stripping potassium, the way many diuretics do. 2 tablespoons of fresh parsley chopped into food every day. A bunch costs almost nothing and lasts a week. This is not folk medicine. The mechanism is biochemically documented. Second, cucumber eaten, not applied. Cucumber is over 95% structured water, contains meaningful potassium that biochemically counterbalances excess dietary sodium, and provides silica, a compound that supports connective tissue and capillary wall integrity. half a cucumber 3 to 4 times a week at lunch, not in the evening. Third, dark berries, blueberries, blackberries, bilberries. They contain a class of compounds called anthocyanins that directly strengthen the walls of small capillaries and lymph vessels, reducing the rate at which fluid escapes through those walls into surrounding tissue. The puffiness under your eyes is, in part, capillary leakage fluid that has seeped out of small blood vessels into the loose periorbital connective tissue. Stiffen those walls and the leak rate slows. A half cup daily, in oatmeal, in plain yogurt, in water as a light infusion. Now the protocol. 4 parts: morning, daytime, evening, and before bed. This is the one sequence thing that changes the mirror. Morning before you stand up. While still lying in bed, place the pads of your 3 middle fingers flat against the inner corner of each eye where the bridge of your nose meets your eye socket. Apply gentle but firm downward pressure, not scrubbing, not rubbing angled slightly outward toward your cheekbones. Hold 10 seconds. Release slowly. Repeat 3 times. The lymph capillaries draining the periorbital tissue run in exactly this direction, from inner corner outward toward the ear nodes. You are mechanically initiating the morning drain before gravity and movement are available to do it. Then immediately find that lymph node point you located earlier, just in front of your jaw hinge. Press firmly with your index and middle finger together. Hold without movement for 60 seconds. Maintain steady pressure. Do not rub or massage, press and hold. You may feel mild tenderness or a faint pressure sensation radiating upward. That is the node responding to the stimulation. After 60 seconds, release. Now make 3 slow, firm strokes from that point downward along your neck toward your collarbone, always toward the heart, never upward. This physically moves lymph from the facial drain gate through the neck and back toward the bloodstream. Total time, 90 seconds. Every single morning. Daytime. Every 2 hours of sitting, perform 20 slow jaw circles. Gentle, deliberate, full range, and 20 neck turns. 10 each direction, slow and controlled. These mechanical contractions squeeze the facial and cervical lymph vessels, keeping the conveyor belt running throughout the day rather than stopping for hours at a stretch. Set a phone reminder if you need it. Evening. 2 hours before bed, take your last meaningful drink of fluid. After that, sips only. Prepare dinner without processed cheese, cured meats, or condiments from jars. One complete clean evening, no hidden sodium, no alcohol, will show you something specific in the next morning's mirror. Do not skip this step and expect the morning work to carry the entire load. Before bed, lie on your back and place a folded blanket or 2 firm pillows beneath your calves, just enough elevation to angle your lower legs slightly above hip level. This shifts fluid dynamics overnight. Rather than pooling maximally in the extremities and then flooding back through the kidneys in early morning hours, the fluid redistributes more gradually, and your kidneys process it at a rate they can manage efficiently. The periorbital tissue receives less overflow. Evelyn did these 4 things. She replaced her evening cheese and crackers with roasted vegetables and a small portion of salmon. She set her evening wine aside, not forever, but for 3 weeks of observation. She pressed the jaw node for 60 seconds every morning and did the inner corner drainage. She began 20-minute walks after dinner, which kept facial and cervical lymph moving through the last hours of her day. After 2 weeks, the change she noticed was specific. The puffiness was smaller at noon than it used to be by 8 in the morning. The system was draining faster than it had been accumulating. The floodplain was drying at the edges first. By 6 weeks, the morning mirror looked the way she had been trying to make it look, with serums and patches and devices that were always targeting the wrong thing. 5 things you can do starting tonight. 1. Do the press test under one eye right now. Note whether recovery is fast, moderate, or slow. Write it down. This is your baseline. Retest in exactly 2 weeks. 2. Look at tonight's dinner and identify the single largest source of hidden sodium cheese, cured meat, a condiment in a jar. Remove it. Replace it with anything that grew out of the ground. 3. If you were planning an evening drink tonight, skip it. Not forever, just tonight and the next 2 nights. 3 mornings without it will show you something measurable. 4. Tomorrow morning, before your feet hit the floor, 3 slow inner corner presses, 10 seconds each. Then 60 seconds of steady pressure on the jaw node. Then 3 downward strokes along the neck, 90 seconds total. 5. Add 2 tablespoons of fresh parsley to one meal tomorrow, into eggs, onto fish, into whatever you're already eating. Start giving your kidneys what this specific mechanism responds to. Before you go, I want to know 2 things. How old are you? Write your age in the comments right now. The age of this audience directly shapes what I explain next. The kidney filtration decline at 62 looks different from what is happening at 74, and if I know where most of you are on that curve, the next video is built around exactly your physiology, not a generalized average. And tell me where you're watching from, which city, which state, which country. I want to see how far this conversation is actually reaching, because the people who need this information most are spread across places I cannot see from here. If someone you know has persistent under-eye bags they have been told are genetic or irreversible, send them this. Not because it guarantees a specific outcome, but because they have almost certainly been offered no explanation beyond the cosmetic surface. You may be giving them the first physiological understanding anyone has ever offered. The mirror doesn't lie. It has just been misread for a long time. Now you know what it's actually showing you.